Welcome back. Tonight we're discussing the 21st Century Cures Act. President Obama signed it into law 2 weeks ago. It provides around $6 billion in funding for cancer research, mental health services, and opioid addiction treatment. This comes at a time when the number of opioid deaths has surpassed gun deaths in the United States. In addition, the law creates a new government position, Assistant Secretary for Mental Health and Substance Abuse. Joining us now for more on how the Suncoast could be affected is PJ Brooks, Vice President of Outpatient Services for First Step Addiction Recovery, Dr. Brendan McCullum, Director of Outpatient Services and Prevention Services at Coastal Behavioral Healthcare, and Dr. Kevin Kohler of the Florida Cancer Specialists and Research Institute. Gentlemen, thank you for being with us here today, especially on this holiday week. So first of all, I just want each of you to share your thoughts. Sometimes legislation is enacted and funding is put aside, but the results don't always come, even if we put millions or billions of dollars. So I want you each to share how you think this will really make a difference. Will we really see those measurable results?
I'll be honest, I think it may be a little too early to tell. And the reason for that is that though it's been enacted, the state of Florida, their application for the funding does not go in until February 17th. And then they'll see what's going forward. My hope is that as it rolls out, that it'll allow us to look at ourselves locally and address from a community perspective what we need to do in our area when it comes to substance abuse issues.
I believe it'll definitely help be in the step or right direction for mental health services. We need to have more impact on prevention and education about mental health services.
Yeah, I think it's absolutely going to help. For cancer research, it generally takes years before we get any sort of a result from the initial investment. But without this kind of research dollars, basic scientists in the NIH, for example, or the NCI, wouldn't have the kind of opportunities to make the kind of discoveries that we need to partner with the industry to make new drugs and have clinical trials for.
And PJ, let's go back several decades and talk a little bit about the evolution. We had mentioned, this is the biggest step since JFK was president. Where did we go wrong over the last several decades when it comes to mental health care?
If I was to pinpoint anything, when Nixon started the war on drugs, the war essentially has been a failure. We've taken a punitive approach around what happens when we're dealing with a disease. And I think we're finally reaching a point where we're willing to recognize, even our law enforcement agencies here locally and around the nation are saying we cannot arrest our way out of this problem. And I think that's finally being recognized, and we're taking that paradigm shift back to looking at this as a disease and that we need to address it from that perspective.
And how do we get to that point? I think it takes also a shift in everyone's mentality, everyone's thoughts about this. How do we as a community foster this kind of environment where we do look at it as just another health issue, just like diabetes or heart disease?
Well, just recently, substance abuse was classified as a brain disorder, so that definitely helps. It kind of takes away the stigma. There is still stigma related to mental health, especially with some of the more severe mental illnesses such as schizophrenia and bipolar disorder. I think one of the main things is that mental health is more of an internal thing that you do not see sometimes, whereas you would see the effects in physical health more in the external.
Okay, now moving to cancer research, because this is part of it, although it's a little bit separate from the mental health care. Where do we lack the most? We've made so many advances in cancer treatment and research, but where are we still really lacking?
Well, where to start? I mean, we have made a lot of advances, especially the last 15 years or so. I think when we have the only diseases that are still curable are essentially when you can take it out of the body, and so a lot of diseases or a lot of cancers you simply can't screen for, and they present in advanced stages. So we still need better systemic treatments for cancers in order to get people not just to live longer, but to ultimately be cured of their cancers.
And I know that there's a thought that maybe some of these cancers will be more managed, kind of like you would care for diabetes, than just actually eradicating the cancer.
Exactly, yeah. I think the paradigm shifted a bit in that going from an old school idea of just giving high doses of chemotherapy to try and eradicate these fast growing cells and in the process causing some toxicity, to maybe managing this a little bit differently and thinking, well, we're going to live with this, but we're going to learn how to live with this, and it's going to be as if you had hypertension or diabetes. And I think we're a long ways away from that, from a lot of different cancers, but we're definitely on the right track. I think a legislation like this helps, ultimately helps practices like mine to do a lot of clinical research engage more in the clinical research and get more people on these newer agents, these newer drugs that are very promising.
Well, great. Much more on that when we come back, along with some of the mental health care as well. And we'll check in with our weather forecast in just a moment. Welcome back. If you're just joining us, we're discussing a recent law that provides funding for cancer research, mental health treatment, and to combat the opioid epidemic. Our guests tonight are PJ Brooks of First Step Sarasota, Dr. Brendan McCullum of Coastal Behavioral Health Care, and Dr. Kevin Kohler of Florida Cancer Specialists. Now, PJ, one of the big hurdles here for people who are dealing with addiction problems is the cost of treatment. It's just prohibitive for so many people.
Absolutely. Unfortunately, much of the current way funding is set up, it's siloed for individuals who need access to care. You have to either be involved with felony probation, you have to be pregnant, or you have to have children to qualify. So if you're a single adult without children, a lot of times and you're indigent, you do not qualify for any kind of funding source, and that's a major restriction right now.
And also, I know you want to pump more into prevention. Tell us how you would go about doing that with this extra funding.
Well, what we're looking at is we really need to infuse more prevention efforts integrated into like schools and other things like that, rather than just doing it as a side piece. It really needs to be part of the overall educational efforts, because if we really look at and really own what's happened, our traditional way of doing prevention really hasn't worked. And we really need to look at better enforcement and really identifying those kids that are more at risk and really focusing on them.
Now, Dr. Kohler, I know prevention can be an issue also with cancer. That's one of the big, I guess, buzzwords that we've been looking into as far as how can we prevent cancer in the first place, or at least help, increase our odds of not getting it. Is this something that you would see with some of this funding possibly towards some prevention or some kind of education for patients, or?
Possibly. I think that's going to be less of a focus, to be quite honest, though. I think a lot of the public health initiatives like quitting smoking and things like that have gone a long way. There might be some more interesting research as far as diet goes into things, but there's been a lot of research in obesity and the relationship obesity plays with the genesis of cancer. But I think what we're ultimately going to be seeing is more spending on the basic science research that needs to happen to actually come up with some of the fundamental science to have new drugs.
And we know those clinical trials are extremely expensive. And yes, so do you see this funding helping to offset some of those costs?
I absolutely do. Yeah, I think it's going to be two-pronged. I think on the one hand, it's going to make some of those costs go down. It's going to make it more affordable for companies to do this research. But I also think it's going to help streamline the FDA process. Instead of going from like the traditional phase 1, phase 2, phase 3 clinical trials, we might see a more streamlined process ultimately. At least that's been some of the indication from the guys at the top of the FDA so far.
And Dr. McCullum, one of the issues with treating mental health is that we just don't have enough practitioners.
Correct.
And it takes a long time to become a psychiatrist and to become a counselor. So what are some of the solutions that you see with that?
Well, right now there are some loan forgiveness programs that are out there. However, they're not very wide-reaching. They're primarily for rural areas, and for instance, Sarasota County does not qualify. There is some language to help empower that and to broaden that scope. We have a nationwide shortage of psychiatrists. There's 20,000, and I believe 25% of psychologists cannot find postdoctoral work once they graduate. So it's difficult to find those higher levels of care. I hope that this expands into licensed mental health counselors and licensed social workers, because the care is all about encompassing that person with as much as possible. And so hopefully we can get to the point where we can lessen the burden of loans that it requires to get this kind of training, so we can have more practitioners to improve our access to care.
And why is it that Florida ranks 49th in the country for mental health treatment?
Funding is probably the primary reason. We are still working on repayment rates from 1999. We have not had a rate increase in our services rendered since then. And I believe I saw that from 2009 to 2012, the federal government revoked $5 billion from mental health services, and hopefully we will be starting to get that money back.
And what do you see as the biggest issue for people on the Sun Coast? What is stopping them from getting the treatment they need?
It's primarily the access to care. It's very difficult to find psychiatrists and trained professionals. I believe for the most part, once you get into a service, it still takes a couple of weeks, even sometimes a month, to get to your doctor.
And PJ, this opioid epidemic, huge on the Suncoast, especially Manatee County. What steps have we made, and where do we still need to go?
We've made, I'd like to believe that we've made a number of great strides, in terms of really looking at the scope of treatment that we can provide within the limited resources that we have available. We've also banded together. You will find that the treatment providers are working hand in hand with law enforcement, with county governments, and everybody's working lockstep to try to figure this out, and we realize that we can't do it alone. And I think if this act does what I hope it does, it can be the resource that can really instigate that effort and really be the tool that really move forward with what we are seeing that we can do. We just don't have the resources to currently do it.
And would any of that include outreach to the homeless population? Because that's another issue, is all kind of linked in together.
They are one of the primary populations that's single adult without children, that often does not qualify for either substance abuse or mental health funding. We can work towards getting them on Medicaid, but there's a disability process that is horrific at times. It takes 6 months to a year, and if someone has a mental health or substance abuse issues and they're out there actively using or actively in the throes of their mental illness, it's hard to get them in, to keep them consistent, to get them to qualify.
And Dr. Kohler, what about people who have cancer, who don't have either don't have insurance or don't have insurance that covers all of the treatment that they need? Where can they go to? What do they do at that point?
Yeah, that's actually not an infrequent issue we deal with. So we usually partner locally with hospitals and infusion centers to get them the drugs we need. And in my practice, we actually do have a decent percentage of people who simply don't have insurance. And here locally, we work with Sarasota Memorial, and we're able to kind of get them the treatments that they would have otherwise needed.
Okay. And then before we go to break here, a couple minutes left, with Carrie Fisher passing away. She's someone who has been outspoken about her mental health issues. She was even here in Sarasota a few years talking about it. Do you think it's helpful when you have celebrities and people in the community who are speaking out to, do you think that that helps kind of break down some of those barriers?
Absolutely. It tends to normalize the condition that they are coping with. Mental health and substance abuse it affects everyone. And they are symbiotic in their relationship. I mean, co-occurring disorders are upwards of 70% sometimes. And so definitely having celebrities speak to it, they have a voice, and it's important for them to use that voice to let people know the difficulties that everyday people are coping with.
And I'm sure they're, like we just mentioned, interrelated. Would that be the same for people who are dealing with addiction?
My hope is that we can just, there's cancer walks. Why can't we have a substance abuse walk? Because it is a disease. It's a chronic disease, and if we allow and make it safer for individuals who are successfully managing their disease to come front, and not just celebrities, but your accountant, your grocer, any individual that you care about and don't know that they're in recovery, and give them a safe place to be able to present that. Again, it does speak to normalization and allowing us to recognize it for what it is, a disease.
Yes, true. This is community leaders dealing with all these things, your friends dealing with all these things. And we do have some of those walks here on the Suncoast, but I think that, or some of those, fundraisers, maybe they're just not as prevalent. Maybe that's something that, needs to be worked on to get more people interested in this cause.
Absolutely.
Okay. Well, we're going to take a quick break, and when we return, we'll have final thoughts from our guests, plus what some of our viewers are saying about a program to help get the homeless into housing. We'll be right back. Welcome back. Cancer continues to be a leading cause of death nationwide. Florida ranks next to last in the U.S. for mental health funding, and the Suncoast has become an epicenter for the heroin epidemic. Will a new funding bill from the federal government help address these issues? Our guests join us for their final thoughts. And Dr. Kohler, I want to start with you and just kind of share your final thoughts on this act that has been passed. And then also, if someone is out there watching, each of you, if someone's out there watching and they have one of these issues or all of the above, where do they start if they need help or treatment?
Yeah, so I think this act is going to be a really good thing for cancer research moving forward. And if you're a patient with cancer, you start with your doctor. They would know who to get you to for evaluation. And I always tell people the most important thing that you feel comfortable with whatever doctor you're in front of and you're talking with. The other thing I'd say is as far as clinical trials goes, if people are interested in that and they're interested in these newer drugs that are coming out, which a lot of people aren't, which is fair, but if they are, then they can always be seen locally at a practice such as ours. We're part of the Sarah Cannon Research Institute, and 70% of the drugs that were approved in 2016 actually were at some point in our hands in one of our, either from drug development unit to like a later phase kind of clinical trial. So drug development is a big part of what we do. It's what we enjoy to do, and it's one way we like to reach out and help people. Financially as well, if people can't afford their treatments and that sort of thing, that's something that we've partnered with Sarasota Memorial Hospital to work to give people those treatments. And in general, for those situations, as soon as those problems are identified, they end up coming into our clinics anyways. So and we're happy to see those people and take care of them. So my final thought is I think there's been a very positive legislation. It's going to be expensive, but cancer is an expensive disease. And I think we'll probably see the benefits of it down the road, not immediately, but years down the road.
All right, and Dr. McCollum?
Well, Coastal Behavioral Healthcare services both adults and children. We take basically all Medicaids. We also take Florida Blue, United Healthcare, and we also service the indigent population who may not have insurance. We work on a sliding fee scale where you can pay as low as 5% of the services rendered. So we want to make sure that we get out to those people who are desperately in need so we can make sure to help them where they need it.
All right. And PJ?
Yeah, for services, substance abuse services, First Step of Sarasota has a number of funding sources. We do take most insurances, but and we have a lot of indigent programs. I think, though, as we look forward with this, beyond just what the individuals here locally can do, I think they, in terms of treatment, I think they also can be advocates for what's happening and really speak out to the issue. And really in champion, we've got some local support legislatively, and I think really reinforcing that they're heading in the right direction is really key as we move forward.
All right, well, we do want to share some thoughts from our viewers about the Quality of Life program. This was the story that we shared with you last night. It's run through the Salvation Army and the Glasser Schoenbaum Center. The program has helped more than 350 homeless individuals on the Suncoast get into housing over the past year and a half. And here's what some of you are saying about the program's success. Kathy Hart writes, anything that can be done to positively impact the lives of the homeless, helping them return to a normal society, is beneficial to all of us. Brenda Denardis writes this, I know someone that was in different programs before coming here. 2 just had unrealistic ideas and you were no better when you left. The other one was just a total scam. This program is just awesome and was the best program I have ever seen. And Diane Hannis writes, rents are all over $1,000 per month. Come on, people, speak up and insist on at least $12 minimum wage. It's time this state started thinking of its permanent residents and not just the tourists. If you would like to join the conversation on tonight's topic, you can visit our Facebook page at facebook.com/news@7. We thank our guests, and you can also watch your roundtable on Amazon Fire, on Roku, and on Apple TV if you would like to see this great discussion once again. Thanks to all of our guests for being here tonight. PJ Brooks, Vice President of Outpatient Services for First Step Addiction Recovery. Dr. Brendan McCollum is Director of Outpatient Children's Services and Prevention Services for Coastal Behavioral Health Care. And Dr. Kevin Kohler is an oncologist with Florida Cancer Specialists and Research Institute.